Well, Alan claims he can heal someone's chronic pain in just minutes. It might sound like faith healing, but Alan says it's science. So let's take a look at this treatment in action.
How long has it been hurting to turn your head for?
Like legit 20 years.
20 years.
Yeah.
What I want you to try is just gently turning your head kind of back and forth from one side to the next. How painful would you say that is?
Like a 3.
Your brain is interpreting neutral sensations from this area in your body as dangerous. And how does the brain communicate danger? Pain. So Felicia, I just want you to turn your head and feel the pain. Let the pain come. But it doesn't matter if the pain comes because we know that there's nothing wrong with your neck. How are you feeling right now?
I feel like I want to cry.
Then cry. You're safe. How's your neck feel?
It stopped hurting a little while ago. I felt like something left me.
What have you been holding on to?
Fear.
Fear.
Wow. Comments, docs?
Well, what I saw was Alan addressing the emotional component of her
100%.
pain, right? Hey, you're safe. It's not going to kill you. And she got a relief, right? She got that catharsis, and she felt better. What did you see?
No, in that setting, I think that clearly what played a huge part was the way that Alan presented it, and that the patient wanted to call it
Right.
her faith in this healing
Right.
process, that she wanted it to work. Confirmational bias,
100%.
if you want to call it that, but you know what? It worked.
Right, and we can never underestimate the power that we have as physicians, as healers, all right, who are treating problems over the folks who come to us for help. They want what we are telling them to work.
And
right?
going through that process
Right.
is healing in
It's
itself.
healing in itself.
Dr. Melamed?
Yeah, no, I mean, I agree with that. The power of the mind is very critical. But as we said, like what happened to this patient a week from that point, or 2 weeks after, a month later? What if that patient had a big stress in their life? Did that pain come back again? So the follow-up to see on these techniques is important. But at the same time, I do think, as we said, individually, very important. The brain, I think you have to look at the patient's nutritional aspect, their lifestyle. How's their lifestyle? Like, what is going on in their life? And do they have a obvious structural problem or not? And I think you have to put all of these together to have the best treatment for that specific patient, whether it requires surgery or more psychotherapy, physical therapy, change your lifestyle, change your nutrition. All of this is important and has to be absolutely incorporated.
And I know you do exactly that, Dr. Melamed, that you have not prescribed an opiate, if I remember correctly, in a long time.
Right.
That
Fantastic.
you are relying on the other modalities that you were alluding to get people to deal with their pain.
Absolutely. I focus on the nutrition. I focus on their lifestyle. I'll focus on their ergonomics, how they sleep, how they sit. You work on all of that stuff. And that's why since March of 2018, I don't give patients narcotics anymore after surgery. And guess what? Their recovery is unbelievable, how much faster they're recovering because they're not getting this horrific narcotic medications, which screws up your gut, screws up the brain, screws up your healing. Like, it's just negative in everything. There's nothing positive out of the narcotics. So it's been an amazing transformation for the patient's recovery.
And when you can't successfully taper off the narcotics, it screws up your life. Dr. Melamed, we need more like you. That is fantastic.